See me and my presentation. Это включаем презентацию. And we will talk about polynucleotides. This is one of the modern device in aesthetic medicine, and this is the device that gives the result immediately, gives the postponed result, and we can use them to treat different problems, starting from aging and finishing necrosis that can occur after ischemia. And I will try to share my knowledge about polynucleotides. I'm working with this for the last 6 years. This is my disclosure, and let us talk. So you all know and understand that there are a lot of ways, possible ways to make one younger, but no one is good enough, no one is ideal. And to understand how to rejuvenate our patient, we have to understand the processes of aging, how it goes and what happens, and why the aging occur. This is such table about skin aging, and you can see that there are some key facts, and one key fact is cell senescence, the other one is impairment of mitochondrial activity, and one of the most important is the ROS production. And due to the ROS production and the growing of the quantity of ROS, it caused the low-grade chronic inflammation, and this caused skin degeneration. And we can, but it's really very hard to influence on cell senescence or mitochondrial activity, but we can influence on the level of ROS and on everything that is connected with this, and as number one, it's inflammation. What is inflammation? We can meet in the skin, in tissues, a lot of cytokines, and one of the most important and one of the worst is interleukin-6. This is a cytokine that is responsible for inflammation, and when we have the long-term high level of interleukin-6, the inflammation is going all the time, and it causes inflammation. How it works? So here you see the physiological trend of inflammation. Means when you have sunburn or hot water burn or something else, the level of interleukin-6 goes up, and due to this, when it's on the maximum, our body starts to produce interleukin-10. And when the level of interleukin-10 starts to grow, it causes that level of interleukin-6 and also TNF alpha and interleukin-1, they goes down. And after some time, everything have been normalized. The level of interleukin-10 is enough to reduce the inflammation, and everything is okay. And what happens with aging? If we will look on aging as a low-grade chronic inflammation, we can understand why it happens, because the level of interleukin-6 it goes up, but our body have no ability to produce the enough level of interleukin-10, and due to this, the level of the main pro-inflammatory cytokine interleukin-6 is higher than it should be, and due to this, it causes the low-grade chronic inflammation. And due to the impossibility of production of the enough quantity of interleukin-10, the high level of interleukin-6 causes the inflammations that we call it inflammation. So our aim is to decrease the level of interleukin-6, also interleukin-1 and TNF. And how we can do this? How we can restore the balance? The best way to restore the balance is to influence on the tissues, on the body, in such way that the level of interleukin-10 will grow. And when the level of interleukin-10 will start to grow, everything else will normalize without our influence. So, what really works to increase, normalize, even not increase, to normalize the level of interleukin-10, and as a result to decrease the level of pro-inflammatory cytokines 6, 1 and TNF. As for me, one of the best is polydeoxyribonucleotides, PDRN. What is this? If we will talk about PDRN, we have to understand, first of all, there are a lot of PDRNs on market. And we have to understand that not each PDRN is the same. The majority of PDRNs that we can meet on the market, they will not reduce the inflammation and they will not cause the slowing of the aging, because there are micro PDRN. These are PDRNs that are used in pharma. And what is important? There are some companies that have pharmaceutical PDRNs. Yes, they're okay, everything is good, everything is great, but they are not those medical devices that we are injecting in the skin. What it means? That having some results with pharma PDRN, we have no right to transfer this data to aesthetics. On the other hand, there are cosmetic PDRN. It's hydrolyzed PDRN, cosmetic and meso PDRN. Meso, it's in vials, and cosmetic in creams. They are also okay, maybe they work, but they also don't cause the slowing of aging. They don't cause the rejuvenation of the skin. Just macro PDRN, functionalized PDRN, that we receive them from salmon, are used as medical device PDRN, means medi-PDRN. What means medical device PDRN? These are PDRNs in syringe that can be used as medical device, can be injected in the skin, in the tissues, and after that we will achieve those results that we need. So just those PDRNs that are in syringes, not pharma, not hydrolyzed, cosmetic and meso, just medical device. And what they cause? They cause fast tissue regeneration effects due to the influence on FGF and EGF. Also, they cause the regeneration due to the influence on VAC, vascular endothelial growth factor, and on generation of new blood vessels, and it causes the beta trophy of the tissues of the skin. Also, it causes the beta color of the skin, the much younger color, much more sexy color, and I will talk about this later. Also, they have anti-inflammation effects, as I have tell you before. The effect of influence on the level of interleukin-10 means normalizing of interleukin-10, and as a result, lowering of the level of interleukin-6, 1 and TNF. And also, we know that PDRNs, they are reducing scars to minimal level. If we make this, if we will make the trauma to tissues, and the scar have to appear, if we will inject PDRN around that trauma, the scar will be minimal. Why it will be minimal? Because PDRN, they cause the normalizing of the collagen level. They are normalizing, they have the influence on the neocollagenesis, but also they are normalizing, because there are a lot of things that can have influence. For example, PLA, or such well-known failure as radius, I mean hydroxyapatitis, calcium hydroxyapatitis, they also cause some kind of a neocollagenesis, but it's not the physiological neocollagenesis. They are causing, how they are dealing, this is the reaction on mechanical influence on the skin. So it can't be the right collagen. And PDRN, when we are injecting, they are causing the production of the new collagen type 1 and 3. So what was the evolution of PDRN? Here you can see the medical devices of the first generation, of the second, and finally we have TwAc twice, eyes 2.0 and 3.0, that are third generation and can be used in dermatology and in aesthetic medicine. But let us try to understand what is PDRN, how it works, and why it works, and I will try to ensure you that everything what I have tell you just right now, it's true, not because I think like this, but it's true because it's evidence-based medicine. So we all know about eukaryotes, and I will not stop on this. So eukaryotes, these are they are cells that have nucleus. What means nucleus? You all know, yes? And polydesoxyribonucleotides, in general, it's the chains of ribonucleotides starting from 50 until 2000 base pairs. But when we are working in aesthetic medicine, we can use just polydesoxyribonucleotides with the weight of chain from 350 till 500 kilodaltons, not more pairs. Why? Because less they don't work, and they are not polydesoxyribonucleotides for the medical devices, they are razor pharma, and those that are higher, more than 500. First, there is the risk that they will have some gene info, and we know that polynucleotides, we take them from salmon, so nobody wants to inject something that have genetic info from the fish. Other hand, we can meet polynucleotides with the molecular weights more than 500, approximately 1,500, where we can meet them. When we have some trauma and there is necrosis, in that necrosis we can meet polynucleotides with high molecular weight. So we don't need them to make the face younger. Yes? It seems to me that it's logic. So when we are talking about gene expression, we have to remember about transcription, about elongation, and about translation. I will show you a small video. It doesn't work? Okay, it doesn't work. It was the video how the transcription goes, but okay, we can work without it. So polynucleotides, they are the natural fraction of DNA, and they can activate the physiological cellular regeneration by indirect fibroblast stimulation. How it works? Everybody thinks that it works by stimulation A to A receptors, but it's not just one. First of all, we have to remember, yes, that PDRN, they cause normalization of interleukin 10 and VEGF, and as a result, the lowering normalization of the interleukin 6, 12, TNF-alpha, nitric oxide. Also, they cause the growing of level of VEGF, and as a result, neoangiogenesis. And also, they have some influence, some indirect influence on fibroblasts and on collagen production. And due to this, we can talk about the wound healing, about the regeneration. So, how it works? As I have told, polynucleotides, they can induce the signal mechanism and have the influence on A to A receptors. But this is not enough, because A to A receptors, they are on the G proteins. Here you see the GPCR family. So those G proteins, they are proteins with a lot of receptors. On one side they have A2A receptor, but near or on the other side they have so-called caveolins. And when there is the influence on A2A receptors, it gives the influence on caveolins, and it causes the normalization of the level of caveolin 1 and caveolin 3. And this causes the normalization of the level of collagen, because level of caveolin have the indirect connection with level of collagen. If there is too much caveolin, we have less collagen. If there is the lowering of the level of caveolin, we have a lot of collagen. And when we have trauma, why the scar, it can be the same trauma, but one person have small scar, the other one have big scar. Why? It's because of the level of caveolin. That person that have big scar, in the place of the trauma, level of caveolin goes down and a lot of collagen appears and the scar is awful. That person that have normal invisible scar, level of caveolin is right. Due to this, level of collagen is also okay, and the scar appears very small. So our aim, our goal is to normalize the level of caveolin, and as a result we will normalize the quantity of collagen, and the new collagen will produce, but there will be not too much, not too less, but exactly as much as we need. And here is the scheme how it works. But if we want to achieve this fantastic result, we have to use some good products. Those good products, they are TwAc, as I have told you. TwAc Ice is the pure polynucleotide. TwAc 2.0 is polynucleotides with HA, and 3.0 polynucleotides with HA. So what is the difference? As I have told you, TwAc Ice, it's 2 milligram per milliliter, so 0.2%, and 250-350 kilodaltons is the length of the chains, and we have 1 cc, and all this in the syringe is sterile, non-toxic. And what we can do with it, we can inject around the eyes, lower and upper eyelids, we can inject in wall the face, we can inject in the case of some urgent situation, but I will tell later about that urgent situation. But injecting under the eyes, we will remove, due to the stimulation of the new vessels, due to the stimulation of the collagen, we will remove dark cycles under the eyes. So this is the big problem, this is the great problem, and this is the only one way how to do it in the safe manner. What means safe? We also can inject HA, but you understand that there is the risk of edema. After injecting just pure PDRN in that area, we have great aesthetic result, and it's totally safe. Also, we can inject in the malar bags. You know, here some ladies, at least 30%, they have malar bags here, such hydrophilic tissue, and we can do nothing with that. Before we start to work with TwAc Ice, there was no possibility to do something. Now we can inject TwAc Ice in that malar bags 1 time per week, 4 procedures, and we remove that malar bags at least for half a year. It's great, because a couple of years ago we have no possibility to do with malar bags nothing. It was a big problem. So TwAc 2.0, this is polynucleotides with HA, non-stabilized, non-cross-link HA, and we can inject it when we have some problems with skin, dry skin, atonic skin, improvement of skin quality, turgor, tonus, for skin lifting. We can inject it in face, neck, neckline, hands, and we can inject it starting from 25-30 years. And what we have, this is 0. No, sorry, it's well, 15 milligram. Well, it's a 5 milligram per milliliter of PDRN. It's 0.5%. So, and we have what is also very important. We have 3 cc in syringe. There is no other product on the market that have in one syringe 3 cc. It's enough for whole face. And it's cheaper because to have 3 syringes in one, 3 cc in one syringe, it's cheaper for production than 3 syringes, yes? So you will earn more money. And the last one, but not least, as for me is one of the most important, is base 30. This is also PDRN with polynucleotides, but there is a difference. First of all, it's 1%, yes, 10 milligram per milliliter. It's 1% PDRN, and we have hyaluronic acid, a little bit cross-link, the very small level of cross-linking, but this small level of cross-linking gives the possibilities that this is like booster system. When we inject, we can do this. With TwAc 2, we have to inject every 2 weeks. With TwAc 3, we can inject 1 time per month, and we have great result. And also, it's better for the more aged patients, starting from 35, 40, until 70. And we will achieve also fantastic result. Here you can see the course, how it is necessary to inject. So TwAc ice every 7-10 days, at least 3 times, but 4-6. TwAc 20 every 14-20 days, 2-3 times, and TwAc 30 1 time per month, and you should inject 1, maybe 2 times, and in very rare cases, patient needs to be re-injected 3rd time. The majority of patients, you will inject 1 time. After the month, you will inject 1 more time of TwAc 3, and you will have great result for 9-12 months. Great and visible. But what I was talking before is just words. Here, some scientific theories, some bases, and just words. And I want to show you some data from trials with TwAc. But before I will show you why it's so important, I will tell you, yes, I will show you data from the trials connecting with vessels and from trial connecting with collagen. But why vessels is so important? And why red color is so important? Look, there will be pictures of women from Prague and from Newcastle. Prague on top and Newcastle on bottom. And there was nothing done, just one picture was made during the period when she is fertile, during the ovulation, and the other picture 2 weeks before or after. And you see that they are much more sexy on the picture where there was ovulation. Why? Because at that moment the diameter of the vessels is bigger, the quantity is more of small vessels, so her skin, we saw some small level of red color, very small, but it's very important, it's much more sexy. Why? Because during ovulation, woman is fertile, so she can start to be pregnant, and she have to send some sign, some signal to men that, well, I'm ready, I can start to be pregnant. And what is the way to send that signal? Just the changing of the color of the skin. Also hormones, pheromones, but changing of the color of the skin is very important, because now we can talk, we can discuss about these things, but 3,000-5,000 years ago, nobody knows, years ago, yes, 3,000-5,000, 10,000 years ago, nobody knows how to talk. And this was just the one way to send the sign that, okay, man, I'm ready to start to be pregnant and to born, and after that to born their child in 9 months. And this is physiology, this is psychology. It's not something modern. Just now we understand how it works, but it's nothing modern. It's as old as the world. But now we can understand this from the scientific point of view. So we make some investigation for 2 groups, and we inject, well, we inject a lot of parts of the face, but I want to show you, you see on the bottom, you see such word chroma. And the level of chroma before of the skull bone was 429. Exactly after injection, it started to be much higher. It's 1370. Why? Because we have injected, it's edema, it's redness, it's okay. Everybody are showing photo before and exactly after. And it's about nothing. But me made the photo 1 month. 1 month after, and you see the level of chroma is even bigger. 4 and 3 before and 1745 now. And you see that this was before and this is 1 month after. The color of the skin of the case changed. It started to be much more sexual. It started to be much more pretty. It's much better, and she looks younger and better. Yes, here 1 month after. And this is the statistic criteria of the same treatment before and after and 6 months after. And we have compared this with control, and you see that even after 6 months the difference is really great. So also we decide to learn how it works on cellular level. There are a lot of publications about polynucleotides, but we decide to make our own trial, and we learn how TwAc, that middle range, yes, how it works on, you see, 5 milligram PDRN, it's 0.5%, and 15 milligram HA. And also you see HA is 1,500 kilodaltons. So we make the trauma and we inject. One group was injected with TwAc, and the second group was control group. We just inject physiological solution. And what we see on day 4, on day 7, on day 14, and on day 21, we saw that on day 20, on day 14, we have regrowth in the group of TwAc, and in the group of natrium chloride with sodium solution, everything just start on day 14. In TwAc, everything was going and starting to finish. In the group of control, just start on day 14. On day 21, we have great result with TwAc and so-so with natrium solution. And, oh sorry, yes. So, and here is the dynamic of vessel density. Red one it's TwAc, and green one it's a control group. You see that group with TwAc, the reparation process was much faster, much bigger, and much physiological than in the group of control. And here you see the dynamic of vessel density. Gray it's control, red TwAc, and green is also control with physiological solution. And here there is the diameter diagrams of newly formed collagen fibers in that place where we make the scalpel wound, and you see that the quantity of the collagen fibers and the total diameter is much higher in the group with TwAc, with PDRN. This was, yes, this was the control group, and this is PDRN group. And it's much more higher, and even the smallest, the minimum diameter with PDRN, with TwAc, is bigger than the maximum. You see, maximum in the control group is 716, and one time was 822. And minimum of PDRN and maximum is bigger. So, and this is the comparative diameter. Here you see the maximum, yes, maximum of PDRN group and maximum of control group, and minimum of PDRN group and control group. The difference is 1.5, it seems to me. And one more. Minimum diameter and maximum diameter with control group and PDRN group with TwAc. So what we achieve is that in the group of PDRN where we inject the TwAc, on the 14 days we have super result, and on 21 day we have great result, really great, and it was stable. In the control group on the 14 days everything just started, and inflammation was till 21 day, and in PDRN group, in TwAc group, inflammation was 3 times lower just till 7th day. And here are example of efficacy of TwAc, but not for aesthetic. As I have told you, I will talk with you that we can use not just in aesthetics, we can also use TwAc to solve some big problems. What means to solve some big problems? There was a girl. She has normal nose, but she decided to change it. And this was the situation on the day 3. And when she comes on the day 5 after injection, you see the awful necrosis, really awful necrosis, ischemia and necrosis. And everybody who sees that nose have tell that there will be nothing, that this nose, there will be necrosis of the whole nose, and it will be necessary to solve this problem just in the surgical way. So what should be recommended? Here you see, yes. And I will show you the process, and after that I will finalize with the recommendation what we have done with that nose. This is during treatment. After some time she decided to help us, and she decides that this crust, why she need that crust, yes, and she remove it. But we don't stop the treatment, we were treating her. Well, the process of treatment was around 2 months, but what we achieved, this was after 1 month, and in 2 months we achieved such result. And as for me, it's a great result, and we restore her nose without any surgery, just using the standard therapy for ischemias, for necrosis, and we also inject her TwAc ice. So there was heal ice, 5 days in total, more than 20,000 units. There was Viagra, sildenafil, 5 days, 100 milligram once daily. Hyperbaric oxygenation, everything is standard. There was no antibiotics, we don't need them. And there was PDRN, TwAc ice, the way injections. We start from application, after that we make injection. It was 10 times every second day. And you have saw the result. So 10 times every second day injection of TwAc ice restore her nose at least for 98 result. Okay, she has some very small scars, but they are invisible, and this is thanks to TwAc eyes. And some results for the skin rejuvenation. One more, it's TwAc 30, one more TwAc 30, and one more face and lips rejuvenation. This is TwAc 20, or you can use also TwAc eyes for the hair regrowth. And this is TwAc eyes for the periorbital area, and one more result for TwAc for the hair regrowth for alopecia. And I'm finishing. I will show you one more video. First of all, I want to invite you all to the Congress that will be in October 11-12 2020 in Kiev. This Congress is bilingual, while one of the language is English, the simultaneous translation, and I want to invite you all to that Congress. And here are my contacts. If you need some info, if you have some questions, please, you can ask me. You can subscribe from my Facebook or Instagram, and you can write me on mail, WhatsApp, Viber, email. I will try to answer, I will try to help you. And now video. Yes? With a special technique, double 7 lift. Why double 7 lift? Because we have double effect and double sides, and 7 because there are 7 lines of injection of this product for achieving the lifting. And as a result, in the period of 1 month, we will also have the visible and very positive changes of the skin quality, because TwAc consists in PDRN, polynucleotides. It is struggling with the inflammation, and as a result cause the real rejuvenation of the skin, the real anti-aging effect, and the visible yes look of the patient even after the first procedure. And what's also made, this technique, double 7 lift, will cause the lifting of walls of tissues, so we will achieve what the patient wants, the visible result exactly after the procedure. And I will explain you how we will inject, and after that I will show you the product. So from this entry point, first we are drawing, after that we will inject in the same direction 7 vectors of lifting. This is the first one to the temporal area, the second one to the lateral forehead area, and on the other hand this is the lateral part of the forehead and its upper part of the eyebrow. The next one is going under the eye. Next one is going to the skull bone. One more is going under the corner of the lip, under the modiolus. One more is going to the lower part of the musculus depressor anguli oris, and the last one is going to the angle of mandibula. From one entry point, just moving the cannula, we will inject 7 vectors of lifting, and we will spend, for this half part of the face, we will spend 1.5 cc of TwAc 30. 1 will be injected in these dots, and 0.5 we are leaving for that part of the injection when we are moving back. And in total it will be 1.5, taking into account that we have 303 cc in one syringe, 1.15 per one part of face. And when I will inject this part of the face, we will show you the patient, and we will see the immediate result caused by the lifting. So the patient will also see the immediate result, she will be happy. And in 1 month we will be happy because we will see the result from polynucleotides that are the main part of TwAc 3.0. And what is the most important, that this product has the biggest quantity of polydesoxyribonucleotides among all the products similar on the market, just similar, because this one is unique. So this is that unique product that I was talking about, TwAc 3.0. We are opening the pack. Inside we have the sterile pack, the blister with syringe. Syringe that consists 3 cc of the solution. We are using the long cannula, opening the syringe, inserting cannula. Once more, you see 303 cc in one syringe, 1.5 per one part of the face, 1.5 per other. And we are starting our procedure. So this is the main entry point, the main and one entry point. It's on the skull bone. There is no anesthesia because we don't need it. We are waiting a few seconds. And we are starting the injections. First we are going up. Normally I'm not driving this, it's just for you. But we saw that cannula is directly under the pants. What is really very important for this procedure now is to make the massage, because we make the bullets, we have to massage them in the direction up and lateral. Up and lateral. So what we achieve on this part of the face, as I have told, result from polynucleotides we will achieve after 1 month. But the first result, based on the procedure, on the technique, and the first result that patient will see, the result of lifting, we saw immediately. You can compare this part that was undone and that part that was treated. We see the difference, we see the freshness, we see the yes look, and we see the lifting of this part. This is what the patient will saw immediately after the procedure. They will see this result of lifting. So it's very important to show the patient half of the pace. And now I will do the second part and you will analyze all the face. So now we see the result of the injection of 3 cc, means 1 syringe of TwAc 3.0. What we can saw is the immediate lifting, immediate freshness of the face, of the skin. Skin start to, we can call it like light from inside. We can see the immediate yes look of the patient. Result of the injection of 3 cc means 1 syringe of TwAc.
Але там, по ідеї, в них ще я бачу на YouTube йде.
Так, але продовжуйте ще.
So, okay guys, if you have any questions, you can ask me now and let us discuss. I will be happy to answer on any your question.
So, doctors, any questions? You can type them in the chat on that YouTube channel, and we can discuss. Maybe you need some answers, or you are interested in something. I will be happy to share my knowledge to you. Why without anesthesia? It's very easy, because when we inject in with cannula, we are making anesthesia, or we cannot make anesthesia in the place of the where we put cannula, and all the rest we don't need. It's necessary just to do it very gentle, and it's painless. It's not painful, and it's okay. If you need to do it with anesthesia, you can do, but please don't mix the TwAc with lidocaine. Just do anesthesia. But if you will do it gently, you don't need anesthesia. It's not painful. Well, is it need second station? Well, sorry, Naba Mohammed, I don't understand the question. Well, for the hair, the best is to use TwAc Ice or TwAc 2.0. But if you will use TwAc Ice, you need to inject the hair every 1 week, every 7 days. With TwAc 2.0, you can inject 1 time per 20 days. So what is the best way to get rid of small wrinkles under the eye? To inject TwAc Ice under the eye, intradermally. Can we use more than 3 cc in one procedure? Yes, we can. Sometimes I'm using 2 syringes. It depends on quality of the skin, or quality of the tissue, how the patient looks like, and also it depends on the financial, on money, because with 2 syringes it will cost twice. So if patient is ready, why not? So is this item used for how much the effect of TwAc 3 will continue? So you as a doctor, you have to analyze the face. This is the question of Rana Mohammed. You have analyzed, make the procedure. After that, to invite patient to come once more in 1 month if you are injecting TwAc 3.0. You will analyze what you see. If you decide that you need 1 more procedure, you are making 1 more procedure. Basically, we are making 2 procedures, sometimes 1, but it's rare. And maybe just 1 time I make 3 procedures. And after that, you will have the result, well, 10-12 months long. Naba Muhammad. No, you can also inject with the needle, to inject in that place that I have put. Yes, 1, 2, 3, 4, 5, 6, 7. You can inject boluses with the needle, and after that make the massage. It's up to you, but for me it's more comfortable to do this procedure with cannula, and it's more safe, because with big cannula we are on the safe side. We will not make the injury of the vessels. With needle, you have to make the aspiration probe every time, and more risk of hematoma. So can we inject to neck by needle? Yes, we can inject neck with needle, but please, you have to inject TwAc Ice or TwAc 2.0. Don't inject in the neck TwAc 3.0. It's too heavy. Naba Muhammad, can use it in nasolabial? No sense to use it in the nasolabial fold. It's not filler. It's something for the rejuvenation of the skin, not for the filling of the nasolabial folds. If patient has static wrinkles in in forehead, what use for it? Well, if patient has static wrinkles in forehead, the best is to use the laser, because static wrinkles, it's static wrinkles. So, sorry, the best is RB-YAG laser to make the skin resurfacing and to minimize that static wrinkles. Some other questions? Well, the best is when lockdown will finish, the best will be to come to you, to Iraq, yeah, or to Dubai, where you are, doesn't matter, and to make the workshop a live, to talk one with the other, to spend a couple of hours, not 1 hour, but to spend 2, 3, 4 hours, and to show you how to inject this, and why we will have 2 results, one immediate, and the other one it's postponed, because well, no one webinar can be as good as a live masterclass. Is there any recommendation after injection of TwAc 30? Well, no recommendation, no some special recommendation. The same as after biorevitalization of filler. Sorry, I don't understand, Dr. Naba Mohammed. No, not Dr. Maba. Sorry, Dr. Yanna. Yes. What do you mean? What's about maintenance? I don't understand the question. Please explain me. What we should maintain? Dr. Nabar Mohammed, can inject also in the lips? Yes, it can be injected in the lips, but you have to be aware that it's not filler. So the result will be for 2-3 months if you will inject TwAc 30, not longer. Lips will be very nice, you will rejuvenate them, but the filling effect will be not long, it's not the filler. Oh, thank you, Dr. Yana. So the intervals for TwAc eyes, the maintenance is 7 to 10 days. For TwAc 20, the interval is from 14 to 20 days. And for TwAc 30, the interval is 1 month. Is it clear? Have I answered on your question? And with eyes, you should repeat at least 4 times, sometimes 6 times. With 20, you should repeat, well, 3 times. And with 30, 2 procedures with the period of 1 month, it's enough. So, the amount of injection in each point, I mean the amount of the amount of gel, how much I leave. So, let me tell you. Here 0.1, here 0.2, here 0.1, here 0.2. It's 0.6, yes. Here 0.1, 0.1 and 0.2, and we have 1 cc in general, yes, and 1 cc. 1/2 of the cc we used when we are doing that retrograde moving, yes, you inject and after that you are going down, and you're using, for that moving you're using 0.5 cc in general, so 1 cc boluses, 0.1 cc for half a face. This is 1.5 cc. So the other 1.5 cc will go to the other part of the face. Once more, 1, 2, 1, 2, 1, 1, 2, and 0.5, so 5. It's for that movements. Now, for smoker lines, yes, you can inject twice eyes, but the result will be not as great as it can be. Between twice profiler, wow, the difference is great, because profiler is just non-cross-linked, non-stabilized HA, and the best in profiler, this is the technique how to inject. And when we are talking about trace, the best is product, it's trace. And this technique is just to achieve the immediate result. You can inject in any technique you want. This one is just useful. Dr. Yanna, the active ingredient is polydeoxyribonucleotide. Well, you can, I'm sure that this video will be on the YouTube channel and you can listen once more, because to repeat everything I need to spend at least half an hour. So the main ingredient is polydeoxyribonucleotide. So, okay guys, then thank you all, and I'm sure that we will meet alive in the nearest time. Alive, I mean not through the internet, not through the YouTube, but alive. I want to see you all, I want to meet you, and I want to share my knowledges with you alive.